Okay, it's 12:30. Good afternoon, everyone, and welcome to this presentation in Health Pathways. We have designed today's presentation mainly for practice managers. My name is Sherry Lynn Garner, and I am the program specialist for Health Pathways Melbourne. We do have Julie in the background with us who will help me in case there are questions around practice management that I am unable to answer. So before we start, I just wanted to acknowledge the Wurundjeri people and other people of the Kulin Nations on whose unceded land our work in the community takes place. Eastern Melbourne PHN respectfully acknowledges their ancestors, elders past, present, and emerging. Just a couple of housekeeping items. We have made all attendees on mute. Please use the Q&A box to ask your questions. So you'll see that link there on your screen. This session, just so that everyone's reminded, this session is being recorded and questions will be anonymous to protect your privacy. Please also ensure you join the session using the name you registered with so that we can mark your attendance. So today we will be going through the benefits of using Health Pathways, how to use Health Pathways Melbourne, how to find new and important changes, hot topics and pathways of interest, and how to access the website. Health Pathways Melbourne is an online resource that provides general practice teams with evidence-based advice on how to access and manage a range of conditions, as well as guidance on local referral options. It doesn't replace textbooks or clinical guidelines. Rather, it translates evidence and best practice into practical advice that can be used at the point of care. Content on Health Pathways includes clinical pathways, referral pathways, and resource pages. The process of developing content or developing and maintaining content for Health Pathways is a collaborative effort between our local GPs, specialists, allied health providers, and other subject matter experts. So why is Health Pathways a valuable tool for general practice? Well, the main thing is that Health Pathways is written for general practice by local GPs. Our team includes 9 clinical editors who are also local GPs. They review and write the content on Health Pathways Melbourne. So our clinical editors, when they're writing content, they approach it from their perspective as a GP and with general practice in mind. They think about what is it do we need to know in general practice and what is useful for general practice. Another reason is that Health Pathways makes many valuable sources of information accessible from one place. In general practice, you receive so much information from so many channels and sources. You've got your newsletters, you've got your different hospital websites, you've got actual news providers online as well. So it is not unusual for you to have so many shortcuts on your desktop and so many pages bookmarked on your browser, probably along with a pile of handouts and flyers on your desk. What we do is synthesize what information is relevant for general practice, and we link out to hospital websites, Department of Health websites, the AMH, the IACGP, therapeutic guidelines, and other sources. So Health Pathway serves as a one-stop shop, a gateway of sorts to a range of clinical and patient resources. Health Pathways complements education and training events, and unlike a PDF or a handout, it is a dynamic platform that we update regularly. A handout, as you know, could easily be misplaced and it could get lost in a pile of paper, or you but it is not just for GPs. For practice managers, you can access advice on infection control, MBS items. You can easily access information and forms for the multipurpose taxi program, certification of deaths, accessibility parking, action plans. There's GP mental health treatment plans in there and many more. For practice nurses, we have a suite of immunization pathways, pathways on chronic disease management, and various health assessments. I will jump on the live site a bit later and show you some of these pages. Next, I'd like to show you how to find information on health pathways and how to find new and important changes. So this is the home page when you first jump on or log onto the website. On the home page, we have a section called Latest News, highlighted there, where we feature health alerts and health warnings from the Chief Health Officer. So we normally show the 5 latest health alerts. And if you click the Read More section, that will then take you to the Department of Health website, where they have the full health alert and advisories. Also on the homepage is a section called Pathway Updates. So in this section, we highlight the 5 latest updates. These may be a mix of new pages that have just gone live and pages that have been reviewed or had a partial update. I have spoken to a couple of practice managers who actually review this section regularly as part of their practice or staff meetings. So they look through what's latest and they discuss that as a team. So that might be something you would consider doing in your practice as well. If you are after a specific information, there are 2 ways you can do this. The easiest way is to just use that search box at the top of the page. And if you are more familiar with the structure of the website, you could actually use the table of contents on the left side of the screen. There are currently 886, almost 900 pages on the site. So hopefully we have covered most of the topics that are of interest and useful for general practice. However, if you do jump on the site, you do a search on a topic and you can't find it, we would love to hear from you, and please feel free to suggest all of these other things that you think will be useful to include on Health Pathways. I'll show you how to send feedback later on in the presentation. So once you've found a page and you're on the page, you may see 1 or 2 boxes at the top. One of them is called, one of them could be the clinical editor's note, and the other one is the COVID note. So first, I'll talk about the clinical editor's note. This is where we include new and time-limited changes that our clinical editor thinks are important to flag. We also use this to share important updates. Sometimes we get updates really the same time as you, which is something that may have been announced in the news the night before. So what we try and do is we quickly put up a link to an announcement in this clinical editor's note, and that way it's up there for you to access, while in the background we work on the bigger updates, the actual page content. So the example on the screen is the clinical editor's note we put up to inform users about the temporary telephone MBS items for the assessment for oral antiviral medication. And the other example there on the bottom left of your screen is a clinical editor's note we put on the HIV page to alert users regarding monkeypox. So at the top, that pink box, that is an example of a COVID note, which has really a similar purpose, but it's different from the clinical editor's note because it focuses on how COVID-19 has impacted clinical care. So in this example, so this is a note on the HIV page. We have a COVID note about every shell being available to be prescribed in primary care. Health Pathways has a 3-year review cycle. So every 3 years, we will do a full review of the suite. But outside of those 3 years, we also do lots of partial updates. And as you probably have guessed, in the last 2 years, we've had many, many partial updates, sometimes as frequent as 2 to 3 times a week. For example, you may find out that criteria for a COVID medication has been updated yet again, but you want to know what is the latest update and how is it different to the update from 2 weeks ago. This is where that section at the top, new and important changes, drop-down box can be useful. Not all pages have this feature. That particular feature is only on the COVID pages because these are the pages that have had very frequent updates. When you click on that, when you open the drop-down box, you will see what the update is and when that update was done. It also lists the three to four other recent updates for the page. The other section where you can find a list of updates for COVID specifically is the COVID-19 recent changes page. So this page has the full list of all changes to all COVID pages, and it's organized by topic and by date with the latest update at the top of the table. Next, I want to spend some time showing you some pages that may be of particular interest. So the first one is the medications in COVID-19 page. This will be more relevant for GPs, so please let the GPs know that we do have this page on the site. So this page contains links to tools to check medication interactions, links to prescribing guides. It has a link to find pharmacies where you can access certain medications. There's guidance on eligibility and where or who to call for prescribing advice. Another page that we put up not long ago, but maybe it's not as topical in the news right now, but certainly still around, is our monkeypox page. So this is another clinical page which includes how to assess for monkeypox, infection control guidance, guidance around privacy and how we reduce stigma in the community, eligibility for vaccine, clinics that offer the vaccine, and numbers to call for clinical advice. And the next one is the COVID-19 practice management page. This page, you may notice on the top left, also has the new and important changes section. The information on this page includes advice on managing vulnerable patients, coordination, which includes information on preparing a COVID-safe plan for your practice, information on the emergency response planning tool, how to set up your practice to be COVID safe. So for example, appointing a practice pandemic leader, advice on reviewing your practice layout, and how your patient flows through your clinic. This page also has advice on infection control, so things to consider around ventilation, patient screening, cleaning, physical setup, and other clinical care considerations. And there's also information on PPE and responding to a positive case in the clinic, which I think by now most of you are quite familiar with general practice guidance on this one. So one page that's actually getting quite frequent partial updates is our Guide to MBS page. It's quite a popular page among practice managers and GPs. It lists MBS items frequently used in general practice, including those relating to COVID-19 and telehealth. So there is information on eligibility for telehealth items. And you'll see that this page lists the service or item name, the number, and the rebate amount. And this links out to the relevant page on MBS Online for further information. Other important information, this time not related to COVID, is the statewide referral criteria. So there are several statewide referral criteria for various conditions, and health services in Victoria triage patients against this criteria. On HealthPathways, where there are statewide referral criteria for a condition on the referral page, on the referral page, we have a drop-down box that says, check the statewide referral criteria. So when you open that drop-down box, it gives you a table and it lists the inclusion, exclusion information you need to include in your referral. In following these guidelines, it just means that there is less chance of your referral getting declined by the health service. For referral information more generally, we have acute and non-acute referral pages on the site, which include information on where you can refer and how. So on a typical referral page, we have a private section where we include links to specialist directories to find private providers. Then there is a public section listing public hospitals and community health services. The services are organized by catchment, so you select your relevant catchment to see the list of services. So once you have the list of health services or organizations, you click on the service to see further information. So each of these would include how they want to receive your referral, what number to call, and what number to call for advice, and which patients do they see and don't see. So you will see that here in this example for Eastern Health, they actually don't have a fax number listed because they want referrals sent to them using e-referral. Next, I would like to show you some of the forms and resources. So for this section, I will just switch to the live site so that you can see where they sit on the website. Let me just drag that screen across. So on the left side here is our table of contents. And if you scroll all the way down, the last item in that section is called Our Health System. And if you open that, you will see the first level of types of pages. So this is where you'll find the MBS items page. And from there, you have the guide to MBS page, which we kind of looked at quickly before. We have the chronic disease management items. There's the GP mental health treatment plan page. There's a whole range of different health assessments. So 45 to 49, 75 plus, health assessments for people with intellectual disability, for refugees, etc. There's a page on telehealth. If you're not yet set up properly, there's some guidance there on how to set up telehealth for your practice. And within our health system, if I just click on forms and resources, so this is where things like accessible parking permits sit, action plans, for example. So you have your sick day action plans for a range of topics: anaphylaxis, asthma, chest pain, COPD, etc. There's the how to issue a certificate of death. There's a page on community transport, which lists the different providers for community transport. Multi-purpose taxi program, which will list the eligibility information. And you have in there links to the actual online forms. So I won't go through each one, but it's really a matter of jumping online, jumping on the website and having a play. And maybe in the next task you have to do, try using HealthPathways and look for the information that, that you need. So let me just go to the next slide. So this is just a summary of where things sit, but we have gone through a lot of that. Okay, so how to access HealthPathways Melbourne. So for you to access these wonderful resources, I just need to show you how to log on to HealthPathways Melbourne. So if you don't have access yet, on the landing page, which is this page on your screen, you will see there, register now. Just click on that link. It will prompt you to complete an online form. Our team will then process your requests and email you your login details. And your login details will include your practice's unique URL. So all eligible all practices who can access HealthPathways in Melbourne have a unique URL or unique link to HealthPathways. And that means if you try and access the site using that link, you don't even need to put in a username and password. For practices that have attended today, you will receive an email with your unique URL, and a link to Health Pathways Melbourne. And in that email, we will include instructions on how to bookmark this link on your browser. We talked about sending feedback. So at any point in time, if you want to ask a question, suggest a topic, or if you find an error or a link doesn't work, a phone number has changed, we welcome really all sorts of feedback. And you can click on the link on the bottom right corner of any page, which will say send feedback. When you open that link, it brings up this form. And in fact, if I encourage you, if you already have access, click on it now and send us feedback and let us know what you found most useful on Health Pathways based on today's webinar. So I think that's it for the presentation. We still have a few minutes. So if anyone had questions, please use the Q&A button and I will look at answering your questions. So far, I don't see any questions in the Q&A section and no questions in the chat box. Oh, hang on, there's one question that popped in just now. So years ago, I was told that we needed a static IP address for our clinic in order to use the method that allowed us to not need a password. We do not have a static IP address. Is this still an issue? No, you don't need a static IP address anymore, but just grab your unique URL from us, and that is the link that will then let you gain automatic access to the website. We were using IP addresses before, but we found that it's become not sustainable because IP addresses change, and if you're on a dynamic IP address, pretty much every time you turn on your computer, your IP address change, which means your automatic access breaks. So we've found something that's more useful, which is we just give you a link specific to your practice. And as long as you use that link, you will always gain automatic access to the website. So thank you for that question. Do you think it would be helpful to open up one-on-one training that GPs can participate in? Yes, more than happy to do that. In fact, we do get some requests every now and then for us to organize a session with your practice. So if you send us an email on info@HealthPathways Melbourne, let me just check if that's on my next slide. Yeah, so if you email that email address and we can organize a time when we can do a presentation at your practice. So either we do it online similar to this, or we can try and come into your practice if you have a big group. Thank you. So I don't see any more questions, but if you do think of any after this webinar, again, feel free to send that through the info@healthpathwaysmelbourne.org.au email address, and we'll get back to you as soon as we can. So I think there is an evaluation survey after this. So if you wouldn't mind, please complete that survey. That would be most appreciated. Will this presentation be available for viewing by others? Yes, it's being recorded, and we will organize for that to be available online. And in fact, because this is the second session, so we actually have a recorded version of this already online, and we can share that around after the event. All right, well, thank you, everyone. I hope you found that useful. Again, my biggest tip is just jump online and start using it, and then you'll become more familiar and remember to use it as part of your day-to-day work. So thank you, everyone, and have a good day.